Remember, love your microphone. 1017 FM and 710 Keel. Robert J. Wright and Aaron McCarty. In studio for a little bit is Dr. Martha Whyte, the regional director for the Louisiana Office of Public Health. It's only been a year. I finally got it right. And the man who proudly wears the banner, Patient X. When you hear Aaron say, David Langston, and I guess David was the first.
Truthfully, he's the first in Louisiana, but the first positive test.
Like winning the lottery, buddy. How lucky can a guy be?
Because he contracted it on, we believe, on the February 21st.
Right.
In the Atlanta airport.
That's right.
But you weren't tested until March 10th.
That is correct.
Okay.
Yeah.
But you were sick.
Yeah, 3 weeks before that test date. I just kept getting worse and went to the quick care 3 times trying to find out what was wrong, and thought it was flu. Didn't want to get anybody sick with the flu.
Sure.
And I would go up. They gave me some steroids, made me feel really good. But and then finally, 3 weeks later, I was having some difficulty breathing and felt really bad.
Mm. Did you suspect you had it at that point?
I said, man, in my mind, I was thinking, what if? And when I went to the doctor the first time, they had a sign out in the lobby, and it said, if you've traveled out of the country, let us know. And I said, I didn't travel out of the country, but I was in the international airport in Atlanta, and I mentioned it to him. And he said, oh, no, you're good. This is just, it's not even here yet. And I'm like, okay.
Oh, wow.
Dr. Martha, I had said last hour in previewing your respective appearances in our studio, I had said what we know now as opposed to a year ago. And I had said, where Dr. Fauci says, nah, no worries. Don't worry. Nancy Pelosi, come to Chinatown. Don't wear a mask, whatever it happens to be. What we know now compared to a year ago, and the fact that right now there are 3, not 1, but 3 vaccines available. And it looks like within months there's going to be an oral available that, according to tests, tests on humans, just completely eradicates it inside that person's body. I'm sure you've read about that. This is, it's borderline miraculous. But to make it a little more secular, it's what a tribute to the healthcare system and the scientific community in this country.
And around the world. I mean, you're right. How many times did I tell you? What I tell you today may change tomorrow. And now we're at the point where it's not changing so much anymore because we have a true scientific basis of what's going on, understanding, and that's growing and growing and growing, just like how long is our immunity? That's developing.
You as a physician, you as a researcher, you as a doctor with more than a little experience, pardon me. First, the last year's got to seem like about 5 years in medical time. And you've got to look back at the last 12 months and just marvel at it all. And I'm trying to be positive about to find sort of a bright spot over the last year.
In the last month, it's been amazing how far you feel like we're taking those steps towards normalcy a little bit again. Mm-hmm. And that's from all that work that's been done over the last year. And that this year has been so overwhelming.
Is it strange in the medical and or the research community to, and I'm trying to think of another situation. The only thing that I can even identify with is I grew up in the 50s and 60s with the Salk vaccine and polio when kids were still getting polio. But that was research, and that was fun. It wasn't on the front page of or on TV or on whatever it happens to be every single day, where every little bit of research that might not be 100% right is out there for everybody to disseminate and go, they don't know what they're doing. You know what I'm getting at?
I do. And I think part of it is because this was truly a novel virus. So no one in the world had been exposed to it at all. Mm-hmm. So when you talk about polio, there were some people who had been exposed and recovered or died and had immunity. And so while that was a huge advance, and what an amazing one, this none of us had ever been exposed to, no one. And so now we're all at risk, and we don't know. I kept saying it's like a playing roulette. You don't know who's going to get the sickest and who's going to do fine.
David, a year ago tomorrow is when your test result came back. They tell you are positive for COVID-19. You've seen the coverage. You've seen the people dying on the cruise ships. You've seen all that stuff from Wuhan. How frightening was that? Did you have a moment where you thought, I might be dying?
I had a moment like that, but my actual first real concern was the concern for others that I may have come in contact with over that 3-week period. I was scared to death for them, and my mom, family members, people I work with, and fortunately nobody got it from me. And because I apparently didn't have the coughing and hacking that can be associated with it, and so I actually was really more concerned about everybody else than myself.
Because you'd been to a class reunion and a bunch of public events, right?
Yeah, I'd been to a class reunion, and Martha and her team called strategically people that I had come in contact with. A lot of quarantining went on with people I came in contact with, and nobody got sick as far as I know.
What's your antibody situation? Because I know that Erin had mentioned to me that Dr. Whyte had mentioned to her, that, or you can both answer that as recently as a month or so ago, you were still donating plasma because your antibody count was still so high?
I was donating because it's the right thing to do. If you have the COVID-19, you're going to have the antibodies, but the little phrase they use now is donate before you vaccinate, because now that I've had the first vaccination, I'm being told I can't donate the
Oh,
antibodies
really?
anymore. Yes.
Oh,
Donate
I'm
before
sorry,
you
I
vaccinate.
didn't know that.
Yeah.
Well, I'm glad you said that. I
David
keep
Langston,
thinking-
who is are you officially Louisiana's first COVID patient? Do we know
Not
that
officially,
for
no.
sure? Okay, but unofficially,
Unofficially.
I'd plant that flag, my friend.
Oh,
And Dr. Martha Whyte from the Office of Public Health. Now,
They have become besties over this past year, and I'm going to let them tell the story because you credit him with helping save your husband.
He did.
Correct.
Yes.
Tell that story.
So he and I became friends because, like he said, we talked a lot about who he had been around, and he was very concerned. And he was concerned about symptoms and when can he go back to work. All that. So we talked a lot.
That's right.
And then when my husband got sick, and he got so dramatically sick so fast, the idea of
your
convalescent
husband also a physician, pardon me.
physician,
Okay.
yes, Dr. Whyte, and he, the idea of convalescent plasma was being discussed around the country, and it had been done once in Houston. And so I said, "Can we give blood?" And he said to me, just randomly out of the blue, "I want to help your husband. I'll give him my blood if I can." And I went, "We were just talking about this." So I got connected with Dr. Bocchini and the blood bank, and we got it done. Literally, that was what we talked on a Friday, and on Saturday he got his blood.
And you know, there's evidence that helped your husband improve.
I know it gave him time to heal, because every time he would be what we call kind of circling the drain, he was doing terribly. Everything was going wrong. We would do an exchange transfusion where they would draw off his blood and give him David's, and he would stabilize. And all of those kind of circling modulators that they were monitoring that were showing he was doing terrible and everything was going south would just even off.
How many times have you donated now, David? Have you kept count?
I've lost count. Yeah.
You look a little gray.
Yeah, it turned my hair from
Well, I
brown
didn't mean
to
your
white.
hair, yeah.
No,
So
I'm
how
kidding.
many patients do you
Bill
think
did
he's
turn hair.
impacted?
Oh, thousands.
Really?
Yeah, I think so. Because if you think how many, like they got 3 doses just for Bill out of 1 donation from him. And then how many bags that he's given, how many those could have been broken down to
Are we
share for
past
other
that point
people.
where you need people, COVID recovers to, do we still need people who have recovered from COVID to donate?
Oh, I think so. Yeah, they still are using convalescent serum. They use it early now. They use it before they, to try to prevent them from going into the ICU.
Tell you what, going to take a break again because you got lots more questions.
Oh, definitely. I
Robert-
want to ask you about the Johnson & Johnson vaccine. I think Robert has questions about that, too.
Yeah, Robert J. Wright and Aaron McCarty, the radio show that, to use the medical lexicon, circling the drain.
We've been doing that for years.